Hello, my name is Dr. Hasan Altahoo and I'll be presenting my research today, which is an audit of pre-operative antimicrobial prophylaxis in plastic surgery, compliance with local and international guidelines. A quick introduction about myself. I got my primary medical qualification from RCSI Bahrain in the year 2018. Then I've done my internship here at Salmania Medical Complex. Then I've worked for a couple of months in a private hospital, Middle East hospital, and I'm expecting to start in the University Hospital of Derby and Burton within 1 month in the UK. In order to understand our topic today on antimicrobial prophylaxis in plastic surgery, we need to understand the concept of surgical site infection, or SSI. SSI refers to an infection that takes place post-operatively involving the part of the body where the surgery took place. And as we can see that it is a very important cause of both mortality and morbidity worldwide. And because of this, the WHO global guidelines and most of literature recommend the use of preoperative prophylactic antibiotics, depending on the type of surgery, of course, in order to prevent a number of complications such as wound dehiscence, abscesses, surgical site infections, and sepsis as well. However, the excess use of antibiotics due to this issue has led to a growing antibiotic crisis with drug-resistant bacteria as well. And literature shows that there is higher rates of drug-resistant bacteria within the GCC countries in comparison to European countries as well, which is why there is a need to regulate the use of prophylactic antibiotics through standardized guidelines. And this brings us to our aim today, which is to evaluate the adherence of giving perioperative antibiotic prophylaxis in plastic surgery with respect to local and global guidelines, and we'll be evaluating this in the largest hospital in Bahrain, which is Salmania Medical Complex. So coming to our paper, it is a retrospective standard-based clinical audit that took place from the start of January until the end of April in 2019, and it was based on recommendation provided by our local hospital guidelines and complemented as well by the NHS and South Australian guidelines for surgical antimicrobial prophylaxis. So these are some brief points regarding our study settings. Regarding data collection and analysis, the two most important elements that we used to evaluate adherence to local and international guidelines on antimicrobial prophylaxis in plastic surgery was the choice of antibiotic and time of antibiotic administration. This was followed by an implementation period of 3 months and a repeat audit that took place from the start of September 2019 until the end of December in that same year. Coming to our results section, I've divided it into 3 sections, which is operation classification, and then followed by the 2 most important elements that we use to evaluate adherence to guideline in this paper, which is choice of antibiotic and time of antibiotic administration. Before we discuss our results, it's important to know why do we need to classify these operations. It's simply because different classes of operations have different antibiotic prophylactic recommendations in the guidelines. We can see that in both the primary and repeat audit, the majority of operations were clean operations, and these were subdivided further into cosmetic, burns, and other clean procedures that don't involve implants or grafting. A minority of the operations were dirty and clean-contaminated, and no operations or surgeries were classified as contaminated operations as well. In general, regarding choice of antibiotics, the total adherence to guidelines, both local and international, were 19.8% in the primary audit, and we were able to improve that after the implementation period to 36.8%. We can see that only 21 surgeries out of 106 were adherent and compliant to antibiotic prophylaxis within the guidelines. Looking at this row here, only 15 out of 97 clean procedures were compliant to antibiotic prophylaxis within the guidelines. No operations were compliant in the clean contaminated class, and all the dirty operations were given prophylactic antibiotics according to local and international guidelines. And we can see here that the sum of these operations make up 21, and the sum of these operations that took place within the repeat audit make up the 43 operations which are adherent to guidelines. Now coming to specifics, regarding cosmetic clean operations like abdominoplasties, liposuction, breast surgeries and implants, it is recommended by our local hospital that a single dose of cefazolin is to be given prophylactically. As we can see that during the primary audit, no operations were given the correct antibiotic, and this was improved later on the repeat audit to 23%. Regarding uncomplicated burns, it is recommended by the NHS that a single dose of flucloxacillin is to be given pre-operatively. No operations were given the correct antibiotic in the primary audit. We were able to improve this to 33% in the repeat audit as well. In comparison, regarding other clean procedures that don't involve implants, grafting, or open fractures, the operations were treated according to guidelines in both the primary and repeat audit, and the recommendation is that no antibiotic prophylaxis is to be given in these subdivision of operations. Regarding clean contaminated procedures, most of these operations were cleft lip palate and in pediatric cases as well. And we can see that in both the primary and repeat audit, none were given the recommended antibiotic, which is a single dose of coamoxiclav. Regarding dirty operations, the recommendation is that they are to be treated therapeutically according to culture and sensitivity, and all operations were treated accordingly in both the primary and repeat audit as well. Our second element of discussion today in evaluating the adherence to local and international guidelines is time of administration of antibiotics. According to our local hospital recommendation, prophylactic antibiotics should be administered within 1 hour prior to surgical incision, and by that time, all antibiotic administration must be complete. The graph here shows the time of administration of prophylactic antibiotics in our primary audit, and these two bars here show the percentage of operations that are compliant with the local hospital recommendation. So only 11.5% were compliant and given antibiotics within 1 hour prior to the incision. And it is very noteworthy as well that a sum of 84% of all operations were given the antibiotic after the surgical incision. So there's a lot to be discussed here regarding quality of improvement. I think it's very clear by now that the most important idea to be discussed today in our paper is the idea of overprescribing. Although prophylactic antibiotics in plastic surgery is still controversial, there are very clear recommendations on contaminated surgeries, clean breast surgeries, and abdominoplasties as well. The main issue in our facility is that we've noticed a pattern of use of stronger, broader spectrum antibiotics with an additional course of post-operative antibiotics as well. If we were to take an example from our paper today, in cosmetic clean operations, the recommended is a single dose of cefazolin 1 gram, which is a first generation cephalosporin. However, we've noticed that during the primary audit, about 80% of operations were given a second and a third generation cephalosporin respectively. A very interesting cross-section study we've seen during our literature review shows that there is preference for surgeons in our facility to give second and third generation cephalosporin in order to prevent post-operative complications. However, the GLASS report published in 2020 by WHO shows that most patients infected by Staph aureus in Bahrain are still susceptible to a narrow-spectrum beta-lactam antibiotic. Yet, studies show that there are high rates of use of third-generation cephalosporin in our hospital. Of course, this shows that instead of using surgeon's preference in prescribing antibiotic pre-operatively, it is recommended that antibiotics are to be given according to resistant and sensitivity patterns in the local population. And this is to prevent the emergence of resistant bacterial strains, which are a significant cause of morbidity and mortality. During our implementation period, we've noticed a number of issues that we try to overcome during our quality improvement strategies. First problem was the choice of antibiotics and overprescribing. We've tried to discuss the most recent recommendation in the form of presentation and distributing leaflets within morning meetings and weekly reviews as well within the plastic surgery department. The second problem was time of administration of antibiotics. We've tried to implement the WHO checklist as our pre-operative checklist, including a section on timing as well to achieve timely administration of antibiotics. And of course, the nursing department in both the OT and the wards play a significant role in implementing this issue. Additionally, we've discussed the need to supply cefazolin in order to implement local and international guidelines appropriately. We've also noticed deficiency in our local guidelines in particular areas like burns, recommendations on clean operations, and clean contaminated procedures as well. So we've discussed these deficiencies with the infectious disease department in order to be included in the next version of our local hospital guidelines on surgical prophylaxis. In conclusion, we were able to achieve our aim, which is to identify areas of improvement in the current practice of preoperative antibiotic use in the plastic surgery department in Salmania Medical Complex. We've improved the choice of antibiotics by 17%, and we were able to improve timely administration of those antibiotics as well by 21.1% using a multidisciplinary approach and regular feedback within the plastic surgery department. Thank you so much for listening. I hope this presentation was useful, and I hope I could join you guys in future conferences after this pandemic.